Assalamu alaikum. So today we have an article that compare the efficiency of dexamethasone and methylprednisolone in infiltration injection for the post-endodontic pain in patients with necrotic pulp, a randomized controlled clinical trial. It was published in 2022 in Pain Research and Management by Iranian group. So the aim of this study is to compare the efficiency of infiltration injection of dexamethasone and methylprednisolone in reducing post-endodontic pain in patients with necrotic pulp. It is a randomized, double-blinded control clinical trial, and they included 80 patients that divided equally into two groups. They included patients that are healthy between the age of 18 and 60 years old. They included necrotic teeth without periapical lesion, with no recent anaglastic or anti-inflammatory drugs usage. And of course, the patients are not allergic to the corticosteroid. And they excluded the patient with systemic diseases, a drug intake, and if the tooth needed multiple visit endodontic treatments. And after the local anesthesia, the patient group A received infiltration injection with dexamethasone, and group B received injection with methylprednisolone. And after the root canal treatment was done, the pain intensity was recorded by VAS score at 5 periods. The first one pre-treatment, the second one at 6 hours, the third one at 12 hours, followed by 24 hours, and lastly at 48-hour period. And for the result, there was no significant difference between the two medication. However, between 6 and 12-hour period, the methylprednisolone showed more efficient pain reduction comparing to the dexamethasone. However, there was no difference in the other periods. And this could be explained by the ability of the methylprednisolone to diffuse faster through the cell membrane, and also due to the shorter half-life time, which gives it the ability to work faster than the dexamethasone. So this article has some limitation. One of them is they don't have any controlled group. So we cannot really compare if the corticosteroid in these cases can be effective or can be significantly effective comparing to the placebo. The other thing is, in this article, they only compare two corticosteroid medication. And in my opinion, they should compare to one of the most commonly used medication and the most widely available medication, which is the NSAID, especially the ibuprofen, to see, do we need to go to higher and more aggressive medications such as the corticosteroid in reducing the postoperative pain, or the NSAID alone, which is mostly the ibuprofen. It's effective to reduce the pain. And thank you.